Good day, passengers. Welcome aboard the Clinical Achievement Tour Bus. Today, we will explore the life experiences, challenges, growth, and achievements of nursing students throughout their clinical journey.
On behalf of BSN 3A Group 1B, ALLIE, COMODERO, ZATCHEY, CORDERO, CASSANDRA de la CRUZ, MIKHAILA, EJERCITO, and BRYCE ESCARAN, we proudly present our research entitled Exploring the Lived Experiences of Nursing Students in Clinical Achievement. Fasten your seatbelts as we will begin our tour.
Welcome to our first stop, the purpose of the study. This study aimed to explore the lived experiences of nursing students in clinical achievement. Behind every duty, requirement, and patient interaction are meaningful experiences that shape nursing students into future healthcare professionals. This study gives voice to those experiences, highlighting how clinical exposure contributes to both challenges and personal development. Passengers, hold on tight as we proceed to our next stop.
Our next stop is the research design. This study utilized a qualitative research design using a descriptive phenomenological approach. Through in-depth semi-structured interviews, the researchers aim to understand the participants' lived experiences, perceptions, and meanings attached to their clinical journey. This approach allowed the study to capture the richness and depth of each nursing student's reality in clinical settings. Please remain seated and enjoy the ride as we continue our journey.
Now arriving at the participant section, the study involved 10 fourth-year nursing students composed of 5 males and 5 females. Participants were selected through non-probability quota sampling with 1 male and 1 female from each section. All participants had exposure to the clinical areas, including the OB ward, medical ward, surgical ward, emergency room, and intensive care unit, providing them with diverse clinical experiences essential to this study.
For this stop, let us look into the instrument used in the study. The researchers utilized a semi-structured interview guide consisting of demographic profile questions, a main guiding question, and follow-up probing questions. The interview followed the STAR method, situation, task, action, and result, allowing participants to freely narrate their clinical experiences in a structured yet reflective manner. Relax on your seats as we travel deeper into the lived experiences of nursing students.
Our journey now takes us to Theme 1, Overcoming Challenges in Clinical Achievement. Participants described clinical duty as a demanding environment filled with pressure, emotional strain, and uncertainty. Many experienced self-doubt during their early exposures, especially when performing procedures or interacting with patients for the first time. They also struggled with balancing academic responsibilities, clinical duties, and personal life, often leading to fatigue and emotional exhaustion. High-pressure areas such as the emergency room intensified these challenges. Despite this, participants gradually developed coping strategies such as time management, peer support, guidance from clinical instructors, and reflective learning. These experiences transformed their struggles into growth, building resilience, confidence, and adaptability.
Welcome to Theme 2, Living Fulfillment Through Meaningful Connections. Participants emphasized that despite challenges, their clinical journey was deeply enriched by meaningful relationships. Interactions with patients gave them a strong sense of purpose, especially when providing care, comfort, and emotional support. These moments helped them realize that nursing is not only about tasks, but about human connection and compassion. Their relationships with peers also played a vital role, as teamwork and shared experiences helped them cope with stress and difficulty. Moreover, clinical instructors significantly contributed to their growth through guidance, feedback, and mentorship, helping them build confidence and professional competence. Overall, these connections strengthened their identity as future nurses, rooted in empathy, compassion, and collaboration.
Our next destination is Theme 3, Integrating Empathetic Judgment. Participants shared that clinical exposure helped them develop the ability to combine critical thinking with empathy in patient care. They learned to assess not only physical conditions, but also emotional and psychosocial needs, leading to more holistic nursing care. Many described situations where they had to make quick yet thoughtful decisions under pressure, strengthening their clinical reasoning and judgment. Through these experiences, nursing students evolved from task-focused learners into reflective practitioners who integrated knowledge, empathy, and patient-centered care in every clinical decision.
We have now arrived at the simulacrum of the study. It represents the holistic journey of nursing students in clinical achievement. At its core is the brain, symbolizing cognitive development, critical thinking, clinical judgment, and decision making. It reflects how nursing students continuously process knowledge and apply it in real clinical situations. Supporting this is the staircase, which represents progression and growth. Each step symbolizes the stages of the nursing journey, from uncertainty and inexperience toward competence, professional identity, and confidence. Surrounding these central elements are representations of the students' lived experiences, their challenges, including stress and self-doubt, their coping strategies, such as support systems and resilience, their meaningful relationships formed with patients, peers, and instructors, and their growth experiences, which shape their transformation as future nurses. Together, the Simulacrum illustrates that clinical achievement is not a single moment of success, but a continuous and evolving journey shaped by both struggle and meaningful experience.
In conclusion, the study revealed that the multifaceted factors influence nursing students' clinical performance and overall achievement. Participants experiences sacrifice, emotional challenges, and self-doubt during their clinical duties. However, through coping strategies, support systems, and meaningful clinical experiences, they develop resilience, confidence, and a stronger professional identity.
For nursing programs, the study recommends strengthening support systems and mentorship programs to better guide students in clinical exposure. For nursing students, reflective coping strategies, time management, and peer support are encouraged to enhance learning and resilience. For future researchers, further studies may explore additional psychological, environmental, and institutional factors affecting clinical achievement in nursing education. As we reach the end of our journey, we are reminded that clinical achievement is not only about skills and performance.
Also about resilience,
Meaningful connections,
Empathy,
And growth. You may scan the QR code for our references.